Thank you, Manisha, and thank you for asking me to speak, and for all of you having me. As an Adelaidean, welcome to the best and the worst of times. March is the right time to have a conference in Adelaide. The weather's perfect. We're very proud of our Festival of Arts and our Fringe, so enjoy that. And as one person who doesn't have an interest in cars, we hate the race. My 20-minute drive to work the other day took an hour and 20 minutes. So there's an election coming up, so hopefully we can change that. The title is correct, but there's a caveat. No one man can cure all pain in the world. But I believe that what's called chronic pain and what's said to be of the brain and in the patient's head is actually originally a soft tissue injury, and that's what I'd like to present. I'm happy to take one or two, maybe three questions along the way, and then at the end I'm happy to take any questions. So by way of introduction, not far from here, 10 minutes max, we have a clinic called the Cold Laser Pain Relief. We use low-level laser therapy to manage and treat a range of things, and it does actually grow year by year. But migraine, chronic back pain, so-called bad backs, shoulder pains, including tinnitus, many chronic fatigue and fibromyalgia, so-called people, and acute injuries, if we see them, do really well. And the brain, we've had about 4 years experience now. Along the way of treating migraines, I realised people had brain fog, and we had patients who had dementia, and we reversed it by treating them the migraine protocol. And along the way, yes, people with brain injuries came along that are decades old. Yes, I suffered migraines for 28 years. My father's a GP, he's 80 this year, he's still practising. University at Flinders, where I do educate, I put my hand up and I said to the professor of neurology, why do I get migraines? And he said, because they're genetic. I knew your father, he got them. And it was a flooring moment. It was like, I've come to uni to learn, and you tell me that. And if you look up migraine in the Greek books, it's half my cranium's going to collapse. And if you look up YouTube, neurosurgery, cut the brain, people are awake and they're in no pain as their brain's cut. So neurology shouldn't own migraine. And migraine's not a disease, it's a symptom of musculoskeletal pain and contraction and referred pain. So I happened to get a phone call to go to Sydney, and I met two doctors, one from NASA, both from America. And what they learned in NASA was that the astronauts would struggle with pain through swelling, through lack of gravity. So they had terrible chronic lymphedema. So 40 years ago, they were loading up the suits with infrared, and the astronauts didn't get pain. They also noticed that the astronauts that spent a lot of time in space came back, and they were more than 4 months. And having been top flight pilots, they all had aches and pains that were so-called arthritis. But after 4 months and 3 weeks of not being able to walk, they all felt fantastic and they didn't have pain. And then they started to realise that it was soft tissue injuries, not arthritis. So that was a chance moment. From that, I joined WALT, which is the World Association of Laser Therapy, and went off to Athens and met 12 people from Australia amongst 150 who were in the field. I encourage you to go to WALT. You'd all be very welcome. We have a vet as a president sometimes. We have naturopaths, there are doctors, there are professors, there's all sorts of people. And that's in a nice place called Nice in October. So think about joining that. There's a Dr. Wilden who's retired now, who was the pioneer of laser of the brain. So I went and saw him a couple of times. Been to Prague. And I used to suffer tinnitus, and when I got rid of my migraine problem, the tinnitus went away. A question. Can anyone pick the 1 out of 3 people that I considered in this to be normal, the normal structure and standing and posture of a human being? Might be too hard. The middle one. If you look at the man on your left, you see how forward his head is? That's not correct. And you look at the one here, he can't hold a book on his head. They have the trapezius spasm that all our migraine and back pain sufferers have. And this shows that we're 6% bone, we're 75% soft tissue, which every patient I meet I say to. And that line there is gravity. So the way we evolved was to turn soft tissue into bone by calcifying it to carry gravity. But no one comes to the clinic with that posture. They all come with forward flexion. The Diana princess fell off a horse at 11 and suffered migraines. So her photography of 1 million photos is the photo of a migraine deformity of muscle spasm. So 100 years ago, no one knew how to fix a broken arm. Then a pseudo-laser light device called X-ray was invented. And now we expect in Adelaide to not have a deformed arm after a fracture of bone, but ligament is soft bone and bone's calcified ligament. So in India today and Malaysia, you can find girls with broken arms that have never been treated and they're deformed. Well, all the patients that come to us are deformed from their soft tissue injuries of too long a duration. And there's a primal reflex of the trapezius, which attaches here and here, that makes them go fetal in bed. No. So this is a really important diagram at work. Everyone gets diagnosed with enziopathy, which is Greek. Every muscle needs a ligament or a tendon. Tendons and ligaments are Adelaide, Melbourne. They're just different locations of soft tissue. And yes, you get in a car. Did you know that in the grave our skull's not attached to our spine? So what holds our skull on in a car accident is our trapezius. And so the classic whiplash, so-called, a burning pain of here and here, is the white matter at the base of the skull and the pelvis being stretched. And so they're micro tears, they're damaged tissue of collagen. So yes, I'm not sure how to go back, but the job is to teach people with the laser therapy or without how they can actually get their skeletal system to be straight. Thank you. I don't know. This one? Okay.
So that's forward. That's
back. Okay. Okay. No. Okay.
It's been taken out.
Oh, that was there.
Okay.
That's right.
So this one or this one?
Okay.
Or that
Yeah.
one, that one. No.
No. No.
What's happened?
Okay, we'll just keep going forward. That's right.
Okay.
Yeah, part of getting people better is to teach them they can actually realise they can come to that site. And I guess what I've learned is how visual we are. And people will say to me, I'm sure my migraines are genetic because everyone in my family gets them. One, you find out they all water skied and did barefoot, or they drove badly. But also the point is that if mum has the migraine posture, the child copies it. And if mum doesn't teach the child not to do that, they will develop migraines purely and simply because their head weighs 5 kilograms and they get RSI. So that's what we learn, is to take the photos to teach people that it's possible to go back to being well. So the world didn't like the fact that there was low-level laser therapy, or there was cold laser therapy, or there was low-intensity laser. So the world came up with photo-biomodulation. And the point I want to make is that there are two parts to that. Photo stimulation, which is the healing, and so every one of my therapists knows they can't put the laser on one spot for more than 8 minutes ever, but we work in the 3 to 6 range. And part of the history of laser being laughed at by physiotherapists was they were given very mild ones 30 years ago and they were told to use it for 2 minutes. And the chemistry is that it doesn't happen in 2 minutes. So hormesis is the term that we brought to the table, and I coined it actually, laser hormesis. It got published in the Harvard Medical Journal. And that is an old Greek term to excite. And you might know that arsenic a little bit is good, but obviously too much is bad. A little bit of UV produces vitamin D, too much burns you. So light, fundamentally, and cells and proteins have this effect that you need to give it enough energy but not too much. And so dentists around the world are using infrared and red for analgesia rather than injecting chemicals. So if you put it on, if you aim at a nerve for more than 12 minutes, you will get an analgesic effect. So we produce analgesic effects in the clinic by knowing that. But if we treated the injury for more than 6 minutes into 8 minutes into 12, we actually inhibit the repair mechanism of it.
How long does the anaesthetic last when using the infrared light?
Yeah, it is a bit variable, but it's at least an hour and a half, and sometimes it's 48 hours. So I say to my staff and people we train, once the proprietor buys a laser and there is a tunable dial and you say 300 milliwatts, the only variable is time. And that's where I see people bringing laser unstuck. There were lots of studies done on tennis elbow, lateral epicondylitis, because it looked like an easy study to do, because you could see it and you could believe the patient was in pain. But they over-treated. And so there's at least 30 trials done that said it didn't have an effect. But the parameters were wrong. So time is the only variable. Too much or too little, that is the question. And that's from Julius Sumner Miller. I had to get that in. Yeah. If not for him, I wouldn't be talking. Covered that a bit, but yes, there's lots of names in the past, but we've thrown them out. Well, the powers, yeah, the world of laser has thrown it out. There's always been an argument at conferences about LEDs aren't as good as laser. It's rubbish, and part of what you're doing says that. Light are photons, photons are light. There are different photons, but it's about photons. And so LEDs have a really important place in our practice. And a bit of a breakthrough was to prove that they could actually get through the skull. Because I had doubts about that, but we've proven it again and again. So I actually teach that, they're smart light bulbs. If we hadn't invented the light bulb, we wouldn't be here. If it wasn't for Einstein, we wouldn't be here. But in the end, they're synthetic light. And it's just a matter of which light you buy as to which illness you treat and for how long. And yes, as long as the photons of an LED get to the site of the inflamed cell or injured cell, they do the same job as the sun does. However, laser light is beneficial because it's synchronised and coherent, and therefore it goes in a very straight line. And as you might have seen, it can go 6 kilometres into the sky. So it will pass through tissue where the LEDs won't. And so it's about penetration. My preferred term is photonic therapies. We're in the business of applying photons to people, and photonics is the label that the physicists use, so I prefer that. I've coined that infrared is the Goldilocks photons. The intensity of which blue light vibrates is greater than red and much greater than infrared. It is used in babies because it's safe. It does develop vitamin D. You can go to dermatology practice any day in the country, anywhere, and they'll have ultraviolet psoriasis treatment and eczema treatment, and it's called mainstream medicine. So it's photonic therapy, but those photons, if they're aimed at the skin for too long, we know will cause cancer, but in the short term, the absorption of their intensity is great at the skin level, and that generates heat, which leads to sunburn. So you can't use that for an internal wound. That's what I call to the patients their back injury is an internal wound, because as you're aware, we treat ulcers and burns on the outside. And that's where red fits in. They're moderate intensity photons used to treat skin ulcers, wounds, bed sores, burns. They penetrate a lot of the dermis, a lot of the skin, but they don't penetrate all. Whereas Goldilocks comes along, the right intensity, invisible, yes, but the intensity and goes through, and our skin hardly blocks any of it. So that's the benefit. Everyone who comes to the clinic has the laser therapy on their skin, and the therapist is taught to blanch it, because the blood in the skin's enough to take some of the light and to be gentle. But a lot of places around the world have scanners, and that's good for wages, but it's nowhere near as good as getting it in deep. The most important thing light therapy does in my world is dilate the lymphatic vessels. So wherever we have an artery in our body, we have a vein. So the lungs put out oxygen and they accept CO2. The point being the veins don't drain the rubbish. It's the lymphatics that do. And so we have lymphatic lake in fluid mechanics, and it's an amazing thing that it is so huge from our toe to our head, but it is one lake. And so it was reasonable for acupuncturists to say, if you squeeze there with energy, you'll move your headache. And they said your headache will go. But I would say you move the toxins from there and they go around. So chronic pain people suffer from a blocked drain. They've been injured for too long. They've produced acute inflammation to try and get better, but it's become chronic. And that chronic rubbish can't get to their kidneys or their bowels. And what we do is what all of us could do right now, and that's to walk outside and the light of the sun hit our vessels, and because that would overheat us if it didn't, it relaxes the smooth muscles, and as they relax they dilate. So by getting synthetic sun into the body where the vessels are blocked, we see the drainage happen. And so I'll show you a photo later on, but people lose 13 kilograms to 15 kilograms if they're supposedly, they are overweight, but in pain, because they retain so much lymphedema. So the light aimed at damaged tissue, and one of the issues I have in 20 years is doctors will say, oh no, those other non-bone things will heal themselves. Some people don't need a plaster when they break their arm because it's only a green stick, and therefore the two parts of the fracture are close. But most people with a broken arm need support, or a strapped ankle needs strapping, so the two parts of the fracture come together. If you do that to your back in a micro world, you have damaged tissue, and it will be damaged as long as you keep straining the strain. But it's perceived that somehow that's not true. So it will stimulate the fibroblasts. They're the generals, we call them, in wounds. Not only do the fibroblasts lead to collagen production, and the building block of all soft tissue, all skin, is collagen, but they're actually the generals, and they tell the mast cells and but the cleaning up cells to go to work. So by getting the light to them, we're actually stimulating the generals to clean up the mess. And therefore, we're reducing the inflammation and the pain, therefore, from inflammation. So inflammation causes pain. Chronic inflammation doesn't do any good. It happens to be that all proteins of pain are red. And so the molecule of a histamine or a prostaglandin vibrates in the red zone. So we'll see a bee sting and we'll say it's a bee sting because it's red. We'll see sunburn because it's red. So all these people who are in chronic pain have 150 plus proteins that are red, and the infrared is almost 100% absorbed by them and denatures them. So the best way to see how it works is a sprained ankle day 5. Someone will hobble into the clinic and they'll have 2 hours of therapy and they'll walk out. We won't say we've cured them because they still have the strain, but they don't have the 5 days inflammation. And literally the light evaporates, just like water on a black car. The lasers we use are in the near infrared. Some people swear 904 is better, but every study I've ever looked at, the maximum absorbed, but it doesn't really matter. It just takes longer by the margins. But when they really get scientific about where the absorption spectrum is maximally absorbed, the cells called fibroblasts and the proteins, it's in the 800 to 830. And that's been proven in hundreds of trials. It's been used for decades, literally 40 plus, on neck and back pain in Europe, particularly in Eastern Europe. So that's why I got to go to Prague, so the people in the poor part of Europe would come to the centre and the rich ones would come and learn from them, because the Russians had written books and books and books in the 80s about what they were doing, but they didn't bother turning into English. So there's incredible history behind the whole thing. There are now what they call RCTs, where you have a placebo. I've got one going in in Israel, in Bethlehem, on top flight pilots who all suffer with, they all retire with neck and back pain from all the G-forces. But there are 400 randomised. If you go to a site called Thor Laser, a colleague who owns a company presented to the United Nations 3 years ago that there were 400 RCTs and there were 4,000 laboratory studies to the Future Forum of Medicine, and we all thought that was going to change the world of laser, but it didn't. I don't want to get too technical, but just to show you that an injured tissue does a few things, and that is, so I'll tell every patient that their injury is only the size of a pen end, because it is. So the micro tear is the size of the end of the pen, but in there's 1,000 blood vessels and lymphatic vessels and 1,000 nerve endings. So when they move and get sharp pain, they are causing another injury of the injury, the 10,000th time, the 100,000th time. And that leads to more bleeding, more swelling. Dead tissue is poorly oxygenated. Whenever it sounds like laser or light is too good to be true, remember that 520 million years ago, the first cell of life had mitochondria that had antennas that took photons from the sun and became us. So normal cells with normal mitochondria, the light just passes through. But when a cell is sick, inflamed, injured, it's in oxidative stress. And so the light, the photon, will be taken by the antenna and turned into ATP. I've gone through inflammation, it reduces swelling, but down the bottom is really important. People don't think enough about this, that if you're swollen, if you've got bruises from swelling, and if it causes more pain. So the vicious cycle is, I'm injured, I don't know where, I'm now inflamed, I'm now swollen, I'm now bent over, I'm now injuring my injury, and the vicious cycle goes on. That's really just to show you that the science is there. I'll finish with Harvard, and they did this. There is no question that we're producing synthetic light to do what the sun's done for 13 billion years. So we're not reinventing the wheel. I've talked about fibroblasts. This is more nitty-gritty. Again, just to give it that credibility that other people question. We don't need to know that stuff, but we need to know that in the lab it's been proven. The armies and air forces and the astronauts in Soviets, just way back, have been using it. It's got to the Premier Division soccer, it's in Olympic teams, it's in Formula One. Someone said over there that, a form of light therapy is happening with the cricketers when they got on the plane from the soccer players. It's all the same thing. In the last 3 years, we've had some pretty important studies where they've done systematic reviews. So they go out and find all the papers for neck pain and all the papers for back pain, and they see where the evidence falls, and they all went in favour. And that began in 2010 when a colleague of mine from Sydney, who's become a professor as a GP, Roberta Chow, she was part of a paper where they, without any doubt, proved that it resolves neck pain. My problem with that is they're saying neck pain and back pain's a disease. It's only ever a symptom. So functional medicine's coming through now, even in Alzheimer's, where we're supposed to be detectives and find a cause rather than say someone suffers back pain. So that's what I'm trying to do, is get to, here's the injury, this is why they suffer pain, make the injury go away, and of course they'll be without pain. Whereas most people are saying a 20 or 30% reduction in pain is significant. As the patient doctor who got better, I had a bit of a moment and I put the light on the back of my neck here. And when I was 6, I chased a boy in the playground, and so I had an injury, but I suffered migraines. Anyway, I put it there and it tingled across my scalp. And anyone who's had a real migraine will tell you that's the ice pick man. And at medical school, no one teaches you that that's the nerve of sensation. If someone else is there and I touch their eye, they'll say right eyebrow because the message goes like that. So migraines actually, when it's really on, it's neuralgia of the scalp. and that's why it's horrible. People say, well, what about the person who doesn't have pain, who has an aura? I go, well, it's not really a migraine because migraine's pain, but every cell in the body is irritated by inflammation in their own way. So if your eye is inflamed, you've got edema, chronic lymphedema, you will be photophobic because the role of the eye is to detect light. It doesn't feel pain. So it will, and then hypersmell, you'll find people with migraines can't stand the smell of perfume or aftershave or chemicals, and actually eat well because they can't tolerate man-made chemicals because their normal nerve of olfactory smell is chronically inflamed. So I patented, which I thought would help going mainstream, but anyway, combining infrared camera, which I'll show in a minute, with the laser beam, we can find, like an X-ray, the soft tissue injury and treat it. The way we work, we call it synoptics. 3,000 years ago in ancient Greece, the synoptics meant viewed together. That's why 3 of the Christian Gospels, and I'm not religious, are called the synoptics. The word synergy is derived from it. The therapeutic process we apply to all our patients requires the therapist and the patient to view together their photography, which I've given you a copy of, which affirms and visualises the pain. So people really enjoy seeing this because they've had all these x-rays, they've asked for answers. The x-rays are macro, this shows their inflammation. A completely different process when compared to radiologists who report on photos from dark rooms without any patient interaction. And that's one of my biggest criticisms of medicine, that you end up having an x-ray you shouldn't have, and you sit in and they sit in a room and never talk to you, and then you get told you've got a disc problem when you don't, and you get told you're arthritic when you're old, and it just creates this incredible business for them and enormous pain for the patient because they're having tests they shouldn't have. And the government's actually trying with MediWise to train doctors to stop doing it. But wherever I'm sitting, I've got people who come to me who don't know my background, and they're demanding these tests. And I say to them, are you going to have an operation? Oh no, I just need to know. You go, no, you don't need to know something you don't need to know. And in medical school they did teach us, they said don't do a test unless it changes your management. But people have piles this big because they're desperate. Our laser protocol is highly synergistic relationship of teaching. Doctor is teacher in Latin. Medici is the art and science of healing. So we don't cure anyone. We teach people self-preservation. Here's your injury. How are we going to get it better together? A journey of discovery and learning in which patients learn to heal themselves from their multiple interactions with a therapist. The combination of both technologies is a symbiotic relationship. And the optics is the study of physics of light, which in turn is the physics of laser. So we meet people, and I do, and my therapists do, for an hour. And in that, the most important question is, when was your body sound? My argument is we treat horses better. If a horse has a broken leg, they shoot it, but 40 years ago they started lasering them when they were lame. So nobody says to these people, you must have had a healthy body at some point. And that makes all the difference because you find out what car accident, when they jumped out of a tree, when they fell off a bike. And then I ask them to put their finger on the spot that in their memory bank before their brain changed, where was the most tender spot, where was the sharp pain? And they all find it. I have to ask some people 10 times, but they find it. Then they have the image of what you've seen there, and the point there is you want to be green because that's the medium temperature. And I've had this thing laughed at 1,000 times by 1,000 doctors, and yet every GP has a little device for temperature gauge, which is infrared. Just happens to be on that part of the skin. Our scale says that the white is the hottest and black is the coolest. It could be the other way around, but because that's the arbitrary part. But it's very accurate at mapping the temperature of the skin. And if someone has the perfect posture I showed before, they're green. So I've proven that to skeptics. And I go and find people who are 18 who have the perfect yoga, tai chi posture, and they're green because they're not inflamed. And when we treat people for chronic pain, it's a 4-month process. They come twice a week. We have lots of people that come from interstate, some from overseas. They come for 3 weeks. They come for 5 days a week. They come for 3 hours. and and the only side effect is that they get very tired. And then I see them once a month after they've had a photograph to see where they're at. Around the world, outside of Australia, it's used even to see diabetes. It can see the camera, it can see a heart problem, as in a lack of blood flow to the heart. But we use it for back injuries, temporomandibular, it's very good for that. And what it really does is see the physiology of thermoregulation. So if you are the green person and we send you outside and it's 45 degrees, you'll come back in and you'll be white everywhere because all your vessels in your skin will have dilated. That's not the blood flow to the toe that you lose in diabetes and lose your toe. It's just the autonomic nervous system through the skin controlling our core temperature. If you die in a boat accident but you don't drown, you die of hypothermia. If we took a photo of you, you'd be black. And the white spot is very accurate. X-ray, CT, ultrasound, MRI are all anatomy tests of the macro, not the micro. It's unique in its capability to show physiology and metabolic process, so that's the diabetes that we use it for. It's non-invasive, has no radiation, it's painless, it's a camera, and has no contact with the body, and in America it's FDA approved. And it's TGA approved here. Unlike most of the diagnostic tests, it's very cost effective. It's the only method available for visualising pain and pathology. It's risk-free, provides instant images, and people like that, we email it to them and they email it to family, and suddenly they get an affirmation that they've actually got a problem. It's really powerful that people who've been living with them can see, oh my gosh, there's something real here. It's not in their head, as the doctor said. So this is a migraine person. What I'd like you to try and focus on is the width of her neck on the left versus her on the right. Her posture's improved. She's only early on. She's only 3 weeks into her treatment. But the muscles relax as the inflammation goes down. And I say to patients, the laser is a gentle pickaxe. It just chips and chips and chips away at this mass. But yes, you can see, it's not quite as clear as mine, but that width is greater than that width. And that's the evaporation. There's the injury around lumbar, spine, transverse processes, and I can pull you. But look at the bulging of the swelling. Yeah, well that's 10 kilograms less. And then the camera is quite specific to say, well, you haven't cured me yet because I've still got those hot spots, but I don't have the rubbish that I had when I walked in. And yeah, so that broad versus this is the chronic lymphedema, which is very toxic, causes inflammation in the brain, causes brain fog. All these people are anxious because they're flighting, because their body thinks someone's trying to attack their neck and back, and they become depressed because the inflammation, when injected into animals and rats 25 years ago, caused depression. So we know in science that chronic inflammation will inflame the brain, and anxiety from that will lead to depression. So the first thing that people benefit from is sleep. So all these fibromyalgia, so-called, chronic fatigue, so-called, they don't sleep even though they're exhausted because their adrenal system of fight and flight is going flat out, which is the sympathetic nervous system, which is what the camera sees. Well, that goes down and the parasympathetic comes up and they sleep like babies. Some of them sleep for 16 hours. It is safe. I'm happy to go through these in more detail with people, but given you've got a laser interest or light interest, but they're the sort of things people ask, you know, and I say we shouldn't call it cold laser. That's a brand that I'm not proud of. But in the beginning, everyone was worried that it would burn because all the lasers they knew that were medical, but it's not. It's actually cool. It's cool, and I say to people, it's 21st century ray lamp. It's only as smart as a hot shower. Why does a hot shower make your back feel better? Because it opens up the blood vessels by vibrating. So none of it's that smart, it's just that people are worried that somehow it's going to do something bad. People do flare. We expect people with tinnitus to have a 30% increase in their noise in the first week to 2, and that's actually acute inflammation adding to the noise. All right, and we've got sort of 5 minutes. At school, I would have been called dyslexic, because that's what everybody is if they can't read. I didn't read, didn't write. Nowadays, I'm obsessed by language. Diabetes is actually Greek for I'm a siphon, so you can't actually suffer diabetes, because it means that you're passing honey, diabetes mellitus, but you can suffer insulin resistance. Migraine is where it started. You cannot cure migraine, but we cure people all the time of their headaches. It's a musculoskeletal problem. I had a medical student from my university as a patient the other day, unrelated to laser. We started talking. He said, we had 3 days on musculoskeletal system. Not pathology, anatomy. That's all they've had. So you go to a GP hoping they'd know something. And my thing is that X-rays made medicine a very dark place, because before X-ray, the doctor had to think about how to make the patient comfortable. Now it's, is your X-ray normal? Yeah, okay, we'll go and see the physio. What will they do? I don't know. They'll probably hurt you, he says. But then when you're in pain, we go, oh, it's in your brain. Or take morphine. Do it. No one is sitting in their office thinking, okay, that person was normal, they must be injured, they're in pain. Part of the physics of it is if you're in pain, there's 3 things. Mechanical injury, when was the car accident? Thermal, are you being burnt or frozen? And chemical. The hormones of pain is what we treat every day. So I learned that the people who have migraines had an accident 2 years prior to their first headache. So I say, when was your first headache that was a real migraine? I was 9. When you were 7, did you fall off a horse? Yeah, how'd you know? And it's that easy. And then they say, oh, you know, females get migraines. Well, they do if they have the neck injury, because estrogen falls off like that prior to the menses. So when the body says, oh dear, there's going to be a bleed, there's vasoconstriction. So vasoconstriction is poor blood flow to the injury, therefore you get the monthly headache. 3 women, genetically apparently, get migraines to 1 man, but that's because women wear shoulder bags and have breasts that are heavy or bra straps. You know? So I said to one professor, does that mean women are less intelligent than men because they inherit migraines more than men? And he wasn't very pleased. But, you know, so we need to eliminate that word. The Greeks were right. The muscle, you know, when you have it, the muscle and the referred pain is contracting your scalp. So, very controversially, 10 years ago I was in America, I was invited, and I presented that tinnitus was chronic lymphedema of the brain. And a professor at Harvard, I'll talk about kindly, and another one from Stanford, they booed and cheered and whatever. And I said to them, but I had it and it went, so I've got an argument. And they went away. I said, the brain is the greatest metabolic rate in the body. You're arguing the brain doesn't have a drain. You're saying because the world's flat, we haven't seen a lymphatic system, the brain doesn't have a drain. If that's right, the brain will blow up. And at that point, I had friends. And that's how stupid medicine can be. You know, I was telling them that once my neck injury went and my back injury went, my tinnitus went. And that tinnitus is a phantom. It's not real. It's not a real sound. It's very much in physics a vibration of the molecules that our eye brain sees as the bee sting, and our nose becomes sensitive to smell. But our ear brain hears it in the high-pitched whoosh, buzzing sound. And about 15 years ago, it was proven by MRI that we have a piano keyboard in our ear brain. And that's because the people who invented the piano didn't want dogs to come running. So for every key, there's a different nerve ending. And that's why it's tinny in Latin, the tinny sound, because these molecules vibrate up there. So when your brain is inflamed and you find it hard to start a word and you get migraines, you have tinnitus. But once you don't have chronic injury, chronic inflammation, you don't have tinnitus. Now we can't cure all tinnitus because some people play music every day. That happens to be in the paper today. You know, damaged, if the nerve endings are damaged. But we've proven that 80% of people who have tinnitus have a soft tissue injury of their back and neck. And once you cure that, they don't have it anymore. So people come all the time with the diagnosis non-specific back pain. The only thing that's not specific about it is the history. If you sprain, everyone hears from me that you have a sprained ankle in a different location. Now physios are not allowed to touch sprained ankles for a good reason. But the pathology of a sprained ankle is the same as the neck and the back. If you stretch it, if you tell them to touch their toes, if you tell them no pain, no gain, you are making them sicker. So by telling people that they have a soft tissue injury in their low back and asking them to put their finger on it, they go back to when they first hurt themselves and they go, ah, yeah, that's always been sore. But the ankle will always tell the calf to contract and make them limp. And no one goes to the doctor and says, my calf is injured, doctor. I can't walk, doctor, because I rolled my ankle. But I can see that my ankle's swollen and I can see that I'm injured. And that's the only difference. So when people start to understand that very simple logic of, if I treat it like a sprained ankle, instead of going for an hour walk up a hill, I might get better. And yeah, if we get people with acute injuries, it is dramatic. People go from unable to walk to cured in 4 to 6 weeks. So a hero of mine is Dr. Norman Doig. He actually came to the clinic and was a patient through the work we do. But in his his first book is the biggest selling book in Nature from 2007 in Australia, but he's Canadian. He's a psychiatrist, he's a researcher. He brought back the word neuroplasticity. But in his second book, chapter 4, it's all about laser therapy. And the laser therapy that is about a Toronto, because he's from Toronto, doctor called Fred Kahn, who's now 97. And I met up with him in his clinic twice for nearly a month, 15 years ago. And through the two of them, they started treating the brain. And through the book, I started treating the brain. So I'm very grateful there. And the point is that when the brain's inflamed, the laser light has a great place to play. And when you treat someone's brain and there's dead tissue, stroke, brain injury, the neuroplasticity takes care of it once the lymphatic drainage has happened. But without the study below, this is the amazing thing, that only 2 years ago did they discover the lymphatic system in the brain. And they literally overnight said change the textbooks. But as I argued before, logic would say there always was, they just hadn't seen it. And they said in Nature 2015, it was named the CNS lymphatic vessels, which drain lymphatic fluid from the brain to the surrounding lymph nodes. And we've always, in 20 years, done an enormous amount of work aiming here, because they're the nodes that drain the brain. The brain drains to there. So by cleaning this area and then getting into the brain, you make a very big difference quickly. So for the first time, they saw these vessels and the distribution of the immune cells. The results surprised everyone. This find is the neuroimmunological version of stumbling across a unicorn. Not only had the system gone undiscovered until now, but textbooks argued against its very existence. As a result, neuroimmunologists have struggled to understand the mechanisms of the brain, or they just ignored it. The vessels carry fluid and immune cells from the brain into the deep cervical lymph nodes, where immune cells enter and exit. 15 years ago, I worked out that tinnitus was that. So Michael Hamlin's the other hero. He's been in Harvard. He's English. You can find him on the internet, YouTube, really easily. Thankfully, there was a Hollywood producer called Wellman, and he got better with laser. So he donated a fortune. And so they've got over 300 people at Harvard working on photomedicine, they call it, Department of Photomedicine. And so he started working on brain injuries 8 years ago, and most of them through Wisconsin were the vets of Afghanistan and Iraq. And so they got a lot of money from that and did really well. And these are his quotes. It's a novel hope for treating complex diseases. The list of applications ranging from pain relief to wound healing is astonishing. Hamlin and his collaborators have elucidated the mechanism of action, the molecular, cellular and tissue level. Hamlin found those suffering from TBIs are at risk for long-term effects. The footballers, it heightens the risk of disturbance of sleep, increasing inflammation of the brain, which leads to Parkinson's and Alzheimer's. Further repeated concussions can lead to that sort of thing. Near-infrared light can penetrate through the scalp and skull to 1 centimetre. Clinical studies show that serial light therapy treatments help those suffering from chronic traumatic brain injury by improving cognition, post-traumatic stress disorder, and we do a lot of that, sleep quality and functioning and verbal memory. This is the professor with his helmet on. And he left this quote, I think, the impact on patients' lives can be dramatic. And I'll finish there. lymphatic drainage. Yeah, so we do treat the brain in migraine as well. But yes, we just have people who come with dementia and they have laser of the brain, but they have the lymphatic drainage. A person I should have quoted in there that you could look up is Dale Bredesen. He doesn't do laser, but he won a Nobel Prize. He published a paper last year on 200 people and 90 of dementia, and 90% were reversed. And one of them was for mercury, but most of it is about inflammation and or insulin resistance. And so he, yeah.
How is his surname spelled?
Bredesen. Dale. He runs a whole sort of university around it now, but it is really, really nice stuff. And yeah, he tells the story of the man that got rich and ate tuna every day, and at 56 he had full-on dementia, and they took the fish away and he got better with all the mercury. But yeah, so what's good for me is he's confirming that inflammation is the issue. I just want to get to meet him to say, soft tissue injuries, do it too. He says there are 36 holes in the house. That's why one drug will never fix it. He actually says throw Alzheimer's out. That was a lovely man who did biopsies on brains 100 years ago. The amyloid's actually protective, but that's for another day. Yes?
Yeah, thanks.
So down the front here, sorry, I've just got one here. You?
Deafness?
No, and that's. I'm glad you asked that. When it does sound too good to be true, if a cell is dead, light can't bring it back. So if you've got damage or congenital deafness, no laser should be sold to you or anything. But some people do have many ears, so-called, and they've got mucus and this lymphedema I talk about, and they get better. But actually, if you test them, they're not really deaf, they just don't hear very well.
Yes, okay.
Yeah.
I wanted to know if there were ramifications from other symptoms that could cause deafness rather than just not hearing very well being labelled deafness.
It's one of my bugbears because people pay a lot of money to go to a tinnitus. Ear, nose and throat charge this, and the ear, nose and throat tinnitus person charges that. And they have a hearing test and he says, I can't do anything, but by the way, you're deaf. And they didn't go there saying they were deaf, but they can't hear the high frequency tester because they've already got the high frequency in their ears. And when they get better, they're not deaf, they can hear it. But so the word deafness is probably the issue. Some people's deafness is not stone deaf, but if you're stone deaf, I can't send you a laser.
Sorry, with the LEDs, you were saying that they were placed in your clinic and that they were to penetrate to even below the skull, I think.
Yes, yeah.
But you said that for the lasers, you use it because of penetration. Mm-hmm. So I just wondered if you could clarify.
Yeah, no, that was what I said. I was sceptical. But the skull is not that thick. That's the point. So we perceive it as being a stone wall. So no, I'll go back to, I'm happy with what I said. The laser will get in 15 centimetres. They've measured it through big thighs like mine, and the LED just won't. But it will get through the skull at the right power and distribute. You've got to you have quite a few of them, but it will. Yeah. We've got a headgear that comes from Canada, and they've done trials directly on Alzheimer's on it and proven reverses. And that's a plug and play, and so people go home with them. And that is LEDs, and it does the job.
Just got one more question down here. I just wanted to know if you've done much work with strokes, because it feels like it would be very beneficial.
Well, that's where, so the answer is, no. The problem I have is I can talk to you today openly, but in trying to make people, because we get a lot of referrals from the rehab at Hampstead, because one particular doctor saw the results and sends them. I can't promote it. I can promote back pain and neck pain, but I can't. So even on autism, we've done really well on autism. And Norman led me down the path that autism, not always, but generally is inflammation. But you can't in Adelaide put a sign up saying we do this. But neuroplasticity is what it's all about. And Norman became famous as much because of a guy in America who cut the arm off monkeys and made them have a stroke. And so he's the first person, but everyone's doing it now, of tying up the good arm so the brain will change and the bad arm will come good. Before that, everyone worked on the bad arm and it never came good. So it is much in the space. You know, I didn't really talk about it, but neuroplasticity is a huge part of taking someone in chronic pain back to getting better, because you see how the brain desensitised to being able to sense the specific injury, because there's so much inflammation. People say, oh, they've got a high pain threshold. Well, it's actually the brain changing. So we see it in so many ways, and yet you're right. The assumption is that a stroke person's got so much brain that's dead, and it's just not true. There are so many other neurons that will rewire. And yeah, so we've done it and we do it, but I can't say it's a lot of people.
Are you selling infrared lasers?
I'm sorry?
Are you selling infrared lasers?
I mean, we do, yes. I mean, we don't, it's not about what, yeah, people take them home. Yeah, we sell $500 ones in 2000. Yes. But it's not really, I mean, yes, if a patient come in to have treatment, we sell them a laser, but we're not sort of like a shop of lasers. Shop of horrors. Hello? Yes?
I was just wondering if the treatment is covered by Medicare.
Are you trying to hurt me? No, I was saying before, a bit of it, because we do a lot of depression and anxiety. One of the private hospital here in Psych have got approval through Medibank to get it that way, but we get a lot of work cover. We sort of but no. I had Medicare, that was part of, that's another story, but Medicare were paying for it, and then they decided they wouldn't. But we charge $140 an hour, and you know, some people can't afford that, but most people, you know, it costs them between $3,000 and $5,000 to get better, and they generally. I mean, it's not. It should. I've tried in this state election for 5 years to get a wing, a little wing like this, at the public hospital. But you know, my life's been full of meeting people who get excited about this, probably like you are, and then they go and see their advisors and their doctors, and they go, "Oh no, there's no evidence." And I didn't say in Washington 3 years ago, those statistics about studies were at the World Conference were produced in there, and there was the Vice President of America was there, and they said we don't have to prove anything anymore. There's very few parts of medicine, any areas of medicine, that have even close to the evidence that we have. But old dogs don't learn new tricks.
Did you mention then that the Psych Hospital actually has the psychiatric department?
Yeah, pardon? As a,
The psychiatric department?
they're using TCM. Yeah, so yeah, keeping people out of hospital with depression and less shockwave therapy. Yeah, no, it's very exciting. But but light is electromagnetic radiation, so you know, magnets, even shock therapy. You know, we do a lot of work. You know, there. You know, we put the laser beam right there, and people get better.
Have you come across yourself or people that have treated people with schizophrenia?
No.
I just wanted to know the extent.
We've treated bipolar no, but PTSD. I give everyone with PTSD beta blockers, but that's probably another conversation. But by actually taking the fight or flight out of people with beta blockers, they actually change their brain. There's a lovely video in the Norman Doig space.
Thank you very much, Mark. I think that you've generated a lot of...
You're very welcome. Thank you.